So good morning. I'm your student nurse for today, sir. I'm Gabriel Bertillo S. Vargas from Angeles University Foundation, and I'm here to assess your skin, your scalp, your head, your thyroid, and we will do some tests. For example, um, is it okay if I will touch you or we'll do some tests?
Yes, sir.
What's your name, sir?
My name is Geoff Basilio Salonga Vargas. I live in Napalit, Pampanga.
Your
And I'm
age, sir?
13 years old, sir.
Okay. So for example, I'm writing his name, his age, where he lives. So this is an improvised tuning fork for the test, and this is an improvised pen light for the eye test. So let's start. So first, I will look at his skin. So look at his skin. If there's a lesions or trigger, if it's yellowish in color, if it has an edema, and I will check if his skin will go back in 3 seconds for abnormality. So it's normal. So I will test the textures. It's normal, and I'm gonna touch if it's normal or not. The temperature, it's normal. So next, we will assess his scalp. Let's see if there is hair loss. Excuse me. So there is no hair loss. So I'll check his scalp for texture. There's no hair loss. There's no. I'll check if there's spots for his hair. His scalp, I mean. So it's normal. So I'll check the color of his hair and the distribution of his hair. So it's normal. Next, I'm gonna check his nails. Sir, can I see your nails? It's normal. The other one, it's normal. So can you do the camera test, sir? Can you do this one? So we are doing this to assess if it's normal or not. So we need to see if there's a diamond shape between his index finger. Yeah, it's normal. So I'm gonna check the color of his nails. So I'm gonna press his nails, and let us see if the blood will come back before the blood will come back in 3 seconds to see if it is normal or not. So ganito yan. Tinrest mo, tapos bumalik siya. Within 3 seconds, normal siya. That's it. So we're gonna do the head and face assessment. So first, we're gonna inspect the head for shape. We're gonna look at his head and configuration, and then after that, we're gonna inspect the symmetry of features of movement. Can you move your head, sir? Left to right, right to left. So next, we're gonna palpate the presence of mass in his head. So yeah, it's normal. And then the tenderness and elasticity. So we're gonna assess the temporomandibular part of his head. So we're gonna ask the patient to open and close his mouth and place 3 fingers over the front of each condition. Place 3 fingers over the front of each and asking the client to open his mouth. Go. Close. Open. Close. so it's normal. And we're gonna check the face of the patient. It's normal. If there's any abnormality of his face features, and yeah, it's normal naman po. So now we're gonna assess the neck. So inspect for position and symmetry, presence of lumps and masses. So tignan po natin. Wala naman po. Inspect for movement of thyroid and clitorid cartilages and thyroid gland. So we're gonna ask the patient to drink or sip of water. Ito. Then we're gonna palpate his thyroid gland. Yeah. So it's normal because his thyroid gland, when he swallows the water, it goes up. And now we're gonna inspect the neck of the range of the motion. So we'll ask the client to turn his chin to the right and left shoulders. So can you turn your chin to the right, to your shoulder, to the left. Touch the chin to the chest and left chin to the ceiling. What I mean ceiling when you go up. So now we're gonna palpate the trachea by placing his finger in the sternal notch. So I'm gonna palpate the thyroid gland if there are enlargement. And also palpate the lymph nodes. Kasi just sometimes meron kang bukol-bukol dito. Sarap, no? That's it, sir. Now, we're gonna assess his eyes. So for example, there's a 14 meters Snellen chart in front of us. And then I'm gonna ask the patient if he can read the number in front. So can you read it, sir?
Yes.
Can you read this one, please?
Yes.
Can you read this one, please? Can you read it? Can you read this one, sir? So you can read the letters in the Snellen chart. So his eyes are normal. So now I'm gonna check his eye structure and inspect and palpate. So now we're gonna check his eyes. So we're gonna do corneal light reflex. So can you, for example, this is a pen light, and then I'm gonna light his eyes. So just open your eyes, sir. So next, we're gonna do the other test. Hey, wait. So now, we're gonna do the cover test. So can you cover your left eye, sir? Can you see this?
Yes. Yes.
The other one, sir? See this?
Yes. Yes.
Okay. So now we're gonna inspect and palpate his eyes. So I'm gonna inspect. So let's inspect the eyelids and eyelashes. So it's normal. So next, I'm gonna inspect the positioning of eyeballs. Can you see your eyeballs, sir? So next, we're gonna inspect the bulbar conjunctive and sclera. Can you open your eyes, sir? So next, we're gonna inspect the lacrimal apparatus, and the cornea and the iris. Nice, eh? So next, I'm gonna inspect the iris and the pupil and shape of the color. So next, I'm gonna palpate the lacrimal apparatus. So now we're gonna do the perla or pupil equally round and reactive to the light accommodation. So for example, this is a pen light. Can you do this? No, don't look at it, sir. So it's normal. So now we're gonna inspect and palpate the ears. So can you move front, sir? So we're gonna inspect the auricle and the pinna and the auditory meatus. So for example, this is a pen light. I'm gonna use the pen light. The other one. So next, I'm gonna inspect for the tympanic membrane using the otoscope. For example, this is an otoscope again. So I'm gonna palpate the auricle, the mastoid process. So now we're gonna do the hearing and equilibrium test. So for example, we're gonna do the whisper test. So in doing whisper test, I'm gonna close the other ear. Can you hear me, sir?
Yes.
Can you hear me, sir?
Yes.
The other one, can you hear me, sir?
Yes.
So now we're gonna inspect the mouth. Let's see if the gums. Let's check the gums for hyperplasia. Can I check the gums? Inspect and inspect. Open your mouth. Inspect if there's any odor in the tongue. Okay. So now I'm gonna palpate the mouth using my hands. For example, I have gloves, but I will not put my fingers inside. Just for example. So now we're gonna inspect the throat. Can you open your mouth, sir? So I'm gonna use pen light to check the throat, and I'm gonna use a so we're gonna inspect if there's any abnormality or what they call this, lesions inside or mumps, in Tagalog, nana, pus, and I will check again your throat. And next, I'm gonna inspect the outside of nose. If there's any moist.
Bad trip.
So next, we're gonna palpate the sinus for tenderness, sinuses for air and fluid or pus, nose. For example, I'm touching his nose. Palpate external nose for tenderness, the air for airflow. So inspect the internal nose for abnormalities or lesions or pus.